In the last 32 years, since the expanded program on immunization, EPI, was launched in the Americas, child mortality rates have been greatly reduced in this region. It's been estimated that more than half of the gains in reducing child mortality in Latin America and Caribbean countries are attributable to immunization, with approximately 174,000 deaths avoided each year in children aged less than 5 years. Additionally, thousands of health workers working at the point of service in the field have been trained in the principles of good public health practice and prevention. Improving management of immunization services at the district level is the cornerstone of their work. It is upon this foundation of good public health practice that the vision for the future of public health improvements rests. The regional EPI was established in 1977 in the Americas when a resolution by the ministers of health of the region called on all member states to expand their immunization programs and requested that the Pan American Health Organization, the regional office for WHO, closely collaborate with governments in their development. At that time, vaccines for only 6 preventable diseases, measles, pertussis, tetanus, diphtheria, polio, and severe forms of tuberculosis were included in the strategy. Since their inception, national immunization programs in the Americas have made tremendous progress. Starting in 2000, the region reported coverage with 3 doses of diphtheria, tetanus, and pertussis vaccine, otherwise known as DPT-3, has been over 90% each year, while the global estimated coverage only reached 80% in 2006. Furthermore, national immunization programs now deliver vaccines against 4 other diseases that are major causes of morbidity and mortality among children, and these include rubella, hepatitis B, Haemophilus influenza type B, and mumps. And only Haiti does not provide vaccination against those latter 3. And several countries have introduced vaccines against seasonal influenza, rotavirus, and invasive diseases caused by pneumococcus. Wild poliovirus was eliminated in 1991, endemic measles circulation was interrupted in 2002, and endemic rubella circulation in February 2009. Vaccines are considered a public health good, and as such, most Latin American and Caribbean countries purchase all their vaccines using their own government funds. Similarly, on average, up to 99% of the routine operational immunization program expenses in Latin America and the Caribbean are covered by these national funds and budgets. Critical for the progress achieved and this vision of the future has been the sharing of information and experiences between countries. To that end, we believe the EPI newsletter, and subsequently renamed the Immunization newsletter, has played a vital role in the documentation of strategies and tactics that are successful in reducing the disease burden of vaccine-preventable diseases. Continuously improving the way we manage information should also lead to increased knowledge and, perhaps more importantly, improved behavioral practices. Ultimately, the future of immunization will hinge upon how well we leverage interdisciplinary partnerships and share our experiences in reducing existing health disparities. New life-saving vaccines must be made available to all those, particularly those who need them most. And within the next 10 years, as many as 10 new vaccines may become available. We now have vaccines to prevent human papillomavirus infection, which causes cervical cancer. But at their current prices, they are not accessible to our communities most in need. As new vaccines are introduced, PAHO's role will be to ensure that they are made available in a sustainable fashion to those who need them most, in particular the poor, the underserved, and the marginalized populations of our hemisphere. To that end, the Immunization newsletter will continue to support health program services in all member states of the Pan American Health Organization. Thank you.